Hello, everybody. Good afternoon. Pat Ziemer here with Magna Wave, and I'd like to welcome you to the Magna Wave Wellness Webinar for this afternoon. And today our topic is sports athletes and how the Magna Wave is used in that type of situation. I have some guests with me today. I have Woody Blackburn, a former professional golfer. I guess I should say professional golfer retired, PGA golfer retired from active play. Jerry Dreesen, Dr. Jerry Dreesen, who is a chiropractor and a sports physician, has worked a lot with athletes with regard to Magna Wave, and Dana Ives, who is one of our practitioners in Florida, who works with the equine side of the athletic performance world as well as the human side. She's worked with doctors in the Florida area with their patients and athletes as this all goes along. It's been an interesting thing for me over the years since we began, in that certainly when we first started, we were working with horses as athletic animals, but we also worked with the riders and to make them feel better, to looser, better range of motion, the whole 9 yards. And it was very interesting to see how all this played. Through the years, we've had the opportunity to work with several professional football teams and professional baseball teams along the way, some very notable pitchers. I worked with some pitchers more than other types of athletes. But certainly now we're doing work with the Tennessee Titans on the football side. They have 3 of our devices and love the therapy that they're using. And so it's been very interesting to take it from horses to small animals to people and how it impacts the athletic world in its use. So that's kind of where we're coming from today with this conversation, to be able to answer questions for you and to just basically discuss the PEMF, Magna Wave PEMF, and from the perspective of an athlete. So what I'd like to do is introduce you to Woody Blackburn, PGA professional, and he's going to tell us a little bit about himself and his activity and how he was introduced to the Magna Wave and what he's experienced, and then he can share and discuss from there. By the way, ladies and gentlemen, if you have any questions, simply post them in the chat box on Facebook, and we would be very happy to answer those questions as we proceed. So Woody, take it away. Tell us a little bit about yourself.
Thanks, Pat. I guess golf has been obviously a large part of my life. I've played since I was a small kid. My dad introduced me to the game. Basketball was a big part of my life early on as well. Played both sports up until high school, when I kind of left basketball behind to focus on golf. Played college golf at the University of Florida. Played the PGA Tour from 1976 until 1989, when I had a pretty severe disc rupture and had to stop playing. My surgeons recommended against surgery and opted for rehab to avoid the scar tissue and the potential problems associated with that down the road. It took me a couple of years to get my back well, but by then I had kind of, being unsure about whether I could continue to compete, I had started a company, which is really where I met Dana and her husband, Robert, which is how I found out about this machine. I wish I'd have known about Magna Wave in 1989 when I was going through this back issue. It might have made a big difference for me. But I started a television production company. We produced fishing programming for almost 23 years. Dana's husband, Robert, was our underwater videographer. And really became one of the premier underwater videographers in the world, working with us, and really meant a lot to us in our production over the years. And I had not seen Robert in a little over a year, and when he called me this past June and wanted to meet up and pick up an underwater housing that we had used years before for a display he was building. And so I met him up in Jacksonville here, and upon seeing him, I was like, I walked over and I said, "What happened to you?" And he's like, "What do you mean?" I said, "Well, you look 20 years younger, and you just look, you don't look like the last time I saw you." And that's when he told me the whole story about being introduced to the Magna Wave technology, I think by a physician friend of theirs somewhere down in Central Florida, and what it had done for him. So I said, "Well, tell me more about this." And he did, and I got all the information from Dana. Sent it to one of my dearest friends who's been my family doctor for over 40 years. And we arranged to start doing 1 day a week with Dana in Jacksonville at his office, seeing his patients and other friends of mine and people that that were looking for something, to help them with various maladies, whether it was elbows, shoulders, knees, back, whatever. So we've been using this machine all summer, 1 day a week over at Dr. Bork's, additionally out at the TPC for some of my golfer buddies here in Jacksonville. And needless to say, it's been extremely successful. Dana does a terrific job, and we saw nothing but success, I would say, for the entire 18 to 20 weeks that she's been coming up to Jacksonville. So I invested in a machine. My son and I have started to put that in play here in Jacksonville. We're going to be at 2 doctors' offices 2 days a week, at 3 country clubs the other 3 days a week, and then depending on how hard he wants to work, maybe at a couple of the fitness gyms and facilities around Jacksonville that are looking for something like this. And right now, I'm pleased to say we have the only machine in Jacksonville, so we're hoping it'll stay that way for a while.
Exactly. I mean, I know that's how it. People want to take a look at it and how it shapes up. That's an interesting background. Just to throw this in for just a second, Woody, you might enjoy this, and we may know some of the same people. Back in the early 70s, I was the director of the fishing hole with Jerry McInnes. You may have remember the fishing hole. There you go. I worked with Jerry a lot back in those days for his fishing show. So at any rate, that's a whole conversation for another time. So tell me, when you started using the device, what did you experience immediately?
I think the biggest thing is probably increased range of motion. And I was thinking about this leading up to this webinar. When you're playing a sport for a living, at one time or another, no matter what sport it is, we all play and learn how to play with pain. One thing you can't perform very well with is when you have limited range of motion. Right. So I've played many rounds of golf on the tour where my back was hurting, but my range of motion was not limited and affected by it. So I was able to play. But once you get that impingement or that restriction on your range of motion, then whatever it is you're trying to do gets greatly impacted, whether it's throwing a ball, running, kicking, hitting a golf ball, whatever it is. I mean, you're going to be greatly impacted. So I think the thing I've been most interested in watching over the summer when Dana has been coming up is, 2 things. One, people getting rid of some inflammation, which is obviously what this whole technology is about, and therefore a reduction in pain. But I've been more interested in seeing how it's impacted the range of motion, especially with the guys I know that play golf. Now, I know it's helped my brother immensely in terms of his range of motion because he's got probably just, I don't know if it's arthritis or just some herniation and some discs in his back, just the typical things that happen when you're 62 and you've played golf your whole life. But I know about 3 months ago, just before he started taking these treatments, when Dana would come up, he had literally just about stopped playing and practicing because it just hurt. And he wasn't able to turn the way he likes to. And so when you played at a high level and all of a sudden you can't do something at a high level, it's sort of not as much fun as it used to be. And it's easy to find something else to do, and he loves to fish. So he's been doing a lot of fishing this summer. But as he took these treatments and as his range of motion and pain have decreased, I know he told me he played yesterday, and he said it's the best I've hit a golf ball in 15 years. So we've seen a real difference made in him. We have another guy who's a friend of mine who, when he started getting the treatments, had stopped playing golf completely because of arthritis in his hands. He couldn't hold the club anymore. I mean, literally, he'd put his hands on the club, and as soon as he'd move the club back, it'd come out of his hands. So he'd stop playing. And I think it was, Dana, correct me, but it was 4 or 5 treatments, 4 consecutive Fridays, and he was back practicing and playing golf again. He's been playing all summer, and he's doing great. So I've seen some pretty spectacular things happen, like in the case of the gentleman with his hands. And I've been very impressed with what I've seen so far, I have to say.
That's incredible. So Dana, you have dealt with Woody, and when you were introduced to him, what was his reaction to what you were going to do? Was he
Woody's always been very open. Yeah, he's always been very open and as well as the physician friend of his. That, in fact, we had a discussion that I think that he actually had one of these machines years ago.
Right.
And then when the FDA found out that he had to send it back. But anyway, Woody was very open, and I have seen nothing major improvement with the golfer with his hands. After the very first treatment, he was able to close his hands somewhat, his hands at all. And then I think it was, I don't know. And now he's able to, absolutely close his hands. And golf said to me, I just don't play golf.
Right. Just wants to play, and you gave him the ability to play again. So Jerry, Dr. Dreesen, from your perspective, as we talk about range of motion, improvement of hands with arthritis and those type of situations, can you give us a little background as a doctor as to how this is happening and what this therapy is doing for that?
So what I really love about what this technology does is in our line of work, we cannot get anybody better unless we can remove the cause of the inflammation. So even if we get somebody better, they're going to continue to re-injure themselves if you don't fix the cause of the issue. And being able to move a joint as far as its function, it can be limited by pain. And oftentimes when you start overriding the pain, like you're taking over-the-counter meds or any kind of COX-2 inhibitor or something like that, and you play through the pain, then you set up the system for even more dysfunction, so that down the road, then you end up with the scar tissue, you end up with the, constant chronic pain that doesn't go away because, you spent 15, 20 years in your sport ignoring the pain or, taking things that you didn't feel it. And so what I've been able to find, with the athletes that I treat, a couple of golfers, I have the arthritic hand situation too, but when you get in there, and you have them start using this system, using Magna Wave on them, it doesn't mask. It's not like an aspirin. That's, what I tell people. You're actually physically changing things. You're creating the stem cells that, that the prolotherapies where you're injecting stem cells along tendons and ligaments that don't have blood supply. This does that. I've got a young pitcher that's in Hawaii that's using this. He's coming in. He lives in the area. When he's on break, he comes in and we're using this on his arm as opposed to going in and doing the injection therapy, and he's getting really good results with that too. Again, with the hands, the weightlifters, when they grab onto that rope and they're pulling the net and their hands are really sore, they just use this for 5 minutes and they call it a refreshing or a restoring. It feels refreshed, and I've had just great success with all inflammatory things. But the thing, not only is it treating inflammation, is it's going in and it's fixing the cause of that inflammation.
That's very interesting, and when you put it like that, it's always intriguing to me today when so often, as Woody pointed out at the beginning, when he said, "I wish I'd have had this in 1989 when I had my problems." And so often we don't get people who come to us until it's a later in the deal. They've already had their problem. It's already done its damage, right. As you pointed out, when someone plays through it, then all of a sudden years later, they've got some damage. Now what are we going to do? So it's the kind of thing that it's preventative as well as it help the situation that has developed. Do you find that in your activities, Jerry?
Well, that's the other thing is when you look at an athlete that, for example, has a knee injury, the surgery itself can cause enough scar tissue that, 10 years down the road makes it tougher for them to walk. If you could go in there non-surgically and work on an area, that's the phenomenal thing about this whole system is that it goes in and it does the healing without having to, make an incision or go in or scrape or cut. And when I first used it, of course, I had two really bad shoulders and a knee from my sports that I used to play. And that's the first thing that I did. That was what intrigued me about you, Pat, was when you were talking about your wife with your shoulder and how when you first used it, was she that was sitting in the car with a smirk on her face and you're like, man, we should do this. And she said, well, I already bought one.
That's right. That's exactly what happened. And it was in Orlando. I mean, that's exactly what happened. She couldn't raise her arm above here, and she was in constant pain. And we went to this conference for anti-aging conference, and they said, we'd like to have a volunteer. And she said, I'll volunteer. They're not going to help my arm, is what she said to me. Went down, sat down for 8 minutes, stood up, total mobility, no pain. And all the way down there, she kept telling me, we're fine. We don't need to get involved with anything else. And then she goes off and buys a machine, and bingo, we're in business. So that's
and I've got a slew of power lifters that use this machine. But we, in our practice, I'll do 2 minutes on every patient after an adjustment or before, and we'll just key on one spot. And everybody, when they use that, they go, what is this again? And I'm not sure if the problem's gone, if it's just, placebo, but, they always have that initial disbelief that something like that happened. And they'll say, well, my doctor uses a TENS unit too. And it's, you got to educate them on what this isn't and what it does.
So Dana, can you tell us from the perspective that when you went with Woody and you went to the doctor's office, you began working with the various clients in the doctor's office, and this was an MD, correct?
Correct.
Yeah,
he's a general practitioner for almost 50 years.
Okay, and so when you went, we're dealing with general patients for general applications, but you could see the improvement in their range of motion and then their pain and so forth, correct?
Most of the patients that I saw at the physician's office were actually chronic. People are you there?
Yeah, you're breaking. We lost you a second. The patients were what? We're here. Can the patients tell us about the patients?
Right. So the patients that were associated with Dr. mostly chronic pain patients and mobility. We had needed more than 1 day a week.
Right. And so they certainly saw.
So that's why right. And what I found with the chronic pain patients, I don't know the whole whatever, but they were different when they walked out than they were. They said, I don't really feel that different. But since I knew they needed more than 1 day a week, I expected to go ahead and get a machine because I'm 2.5 hours from Jacksonville. So for me to do 5 days a week with those folks was just not feasible.
Exactly. But it's something that the doctor saw the potential of and wanted to incorporate it into his practice. That's excellent.
Absolutely. Yes.
So Woody, tell us. Thanks, Dana. Woody, tell us go ahead. I'm sorry. Okay. No. Lead lag here as we're broadcasting. Woody, from the perspective of being a professional golfer, when do the indications develop? When do you realize that they're going to limit you? And what's important as a golfer to prevent these situations from occurring, and how widespread is it? I mean, we see these guys on the tour and they're playing and they all look healthy and that they could do anything, but then we hear of problems like Tiger and people who have bad back issues and that type of thing. Just what do you do? What's their normal regimen, and when do they begin to have to really pay attention to this when youth is no longer controlling what's happening?
Well, I think it's quite different now than it was 25 years ago. Now, we have the fitness trailers on tour that are there Monday through Friday of every tournament, and there are actually physical therapists, that man those trailers. They have all the exercise equipment, A lot of the guys actually take physical therapists with them on tour now that travel with them. So stretching and all the preventative things that you should do as an athlete are now sort of part of their daily routine. Some of that, I think, is that the money is so huge on the tour now, you don't want to be in a situation where you have to miss time. And so guys are doing all the things they need to do to maintain their flexibility and to avoid injury and having to miss that time. Back as little as just 25 years ago, Diversified Products had started a program on tour with Dr. Frank Jobe from Los Angeles, and a couple other guys had put together some fitness programs for the players. And DP actually had a van out on tour with physical therapists and with exercise equipment and stuff. I was always doing stuff because I'd played basketball for so many years, so I just had that drive to want to be doing active things anyway. So I played basketball and I played tennis even when I was on tour, and I stretched. But the ruptured disc I had was just I'd hurt my back in college, and I think it was just something that was eventually going to happen no matter what I did, and it finally did. But the things, Tiger is an extreme example because he got so enamored and consumed with the weightlifting and the training side of being an athlete, even though it wasn't necessarily conducive to better golf. His dad was an Army Ranger. Tiger had a real affinity for the Navy SEALs. He would actually follow their training regimens. I mean, he would run cross country, at 5 o'clock in the morning with 50-pound weight vest and stuff like that. So he was putting pressure on his joints, especially his knees and his back, that no one else that I'm aware of in the world of golf is actually doing. So he's kind of one over here on one side and everybody else is on the other. Hopefully he's gotten his situation stabilized to where he can at least come back and play now. It appeared that was the case when he played a couple of weeks ago because he was not holding back on hitting the golf ball. So hopefully he's going to be well. But I think most of the guys, Pat, are so aware and cognizant of the things they need to do now, not only to stay in shape, but to prevent, that I think you're going to see less and less, the professional side of golf, of guys getting hurt and having to miss time from the tour than you have in years past.
Yeah, that's interesting. It's an interesting story about Tiger and to the point that you need to exercise, you need to work out, and Dr. Dreesen, perhaps you can address this. You need to do it in a fashion that's certainly going to enhance what you're doing, not potentially harm what you're doing. How do you feel about that, Jerry, Dr. Dreesen?
Well, here's the thing. Golf, in and of itself, as a sports physician, we study all the different types of sports and what it does on the body. But, Woody, I'm sure you know that the spine does not go through its normal physiological range of motion when you're golfing. If you talk about the amount of torque and then just the ballistic maneuver of the spine as it takes off to hit the ball, and then immediately it has to slow down and stop the movement, that repetitive motion over and over and over again. And you're not switch-handed. It's always the same position. So you're not doing the left side and the right side. It's a one-sided deal. And so over time, there will be ripping and tearing microscopically of the areas if you're not careful, if you don't stretch out, if you don't hydrate, if you don't take care of inflammation, you start building up the scar tissue that's in there. And then if you do tear a disc, people don't understand that the inside of the disc has a fluid in it, and you can have a micro tear that just allows like a pinhole in that disc. And if that fluid comes out and touches the nerve, it's like fire. And it's kind of like when you cut your skin and you bleed, the blood, forms a scab. That's what that fluid does, the nucleus pulposus, as it goes through that annular tear, and it'll actually heal it, provided you allow it to. But if you're back out on the circuit twisting and doing a rapid fire, you're going to take that hole and break it open even more, and then you end up with more problems. And so back in, like you're talking about, back in the day, 25, 30 years ago, it's, the whole mentality of take one for the team and just buck up and, face your pain and get through the day, because, you're going basically, again, what other job is there where you're forced to go through pain in order to get a paycheck, and there is no time off. And if you do take time off, by the time you go back on the circuit, you almost have to relearn your swing again. And so you want to try and keep everything back, fluid to how it is, and not have an injury. And so there's guys that'll do, injections, they'll take medication, they'll do anything they can to avoid the pain that's going to screw up their game. And I found, again, with the Magna Wave going in there, and I'm sure, Woody, you're finding that out all the time now too, and all my L5 disc patients, they'll get on that, and when they stand up, they go, hey, I notice a difference. I've got a guy that couldn't bring his left knee up, 14 years, military, could not move, and now he's bringing his knee up to his chest, and he doesn't have that pain anymore. And so it's not just masking, like I said, it's going in and actually physically changing the game of athletes. And I'm sure that anybody that's a pro golfer now that's had a lifetime of this is definitely a therapy that they need to get into now, even though they may be done with their career, to go in and have things get reversed so they do start feeling better again.
It's amazing to me when we think about that. Thank you, Dr. Dreesen. When we started, so much of it was help me run faster, help me jump higher, help my horse turn the barrel better, help my horse jump higher. And so it was all about performance. Then it became, wait a minute now, can this help the recovery? Can this help me recover to get back on my game more rapidly? And that the whole cycle changed, and we were able to experience that, which you're talking about there, Dr. Dreesen, as we approach this. So the recovery is just as important as the prevention that we're dealing with, but you need them both in order to make it come to fruition. So, Woody, what have you seen? Go ahead, Dana. Yes.
We've also used this, especially when they perform, because, they go basically until they can't go. And have several movements that they do would kill most of us to do one in a day. Right. And, in between those competitions, they need to recover so that they can be their best for the next. So they recognize the importance of being able
to recover. Perfect. Thank you, Dana. So, yes. Woody, as you have used this on some professional golfers, what has been their reaction, and how have you seen some change and improvement there?
Well, I think probably the best example is probably Vijay Singh. Vijay and I practice a lot together out at the TPC, and as I found out more about this and saw this in action during the summer with Dana, I remember telling Vijay about it, and so I'm kind of pushing him. I'm saying, man, you look like you're getting more like 65 instead of 52, and he's like, man, my knees hurt, my ankle hurts, on and on. So finally, Dana and her husband Robert were in New Orleans to fish, and a big rainstorm blew in. So instead of fishing, they drove all the way to Charlotte, North Carolina, where Vijay was at the PGA Championship in Charlotte back in August, to give him a treatment.
Wow!
And I think he got 2 while you were there, if I'm not mistaken. And
yes.
And he said it helped, yes, quite a bit. And so then he was playing a lot in the fall, and I didn't see him that much. But when he finally got home, I just started pounding on him, and Dana was still pounding on him. So lo and behold, he finally bought his machine here about 3 weeks ago, and he's using it every day. I think he's using it too much. I've tried to tell him more is not always better, BJ. You don't have to sit on it with it, 10 minutes 4 times in a row on the same spot. Let's have a little bit of, let's conserve a little bit. But he's, I don't know. And I asked him, I said, how are you feeling? I saw him just yesterday. We were practicing. He said, I'm feeling great. He looks better than what he's saying, because I can tell in the way he's swinging the golf club it's quite a bit different right now than it was 2 months ago. He's swinging more like a young man 20 years ago now than he was 2 months ago before he started getting into this and was able to treat himself on a daily basis. So I think the difference with him, it looks pretty remarkable to me, just in the physical appearance and how he's swinging the golf club.
We don't realize as we age or as we deal with these things, and Dr. Dreesen potentially address this, how these pains that we've learned to live through or discomfort, or not even, maybe he didn't even know he's having pain, but he just doesn't have the range of motion that he had, and all of a sudden you begin to free that up, and it changes everything, how you can walk, how you can bend, how you can swing, the whole thing. Dr. Dreesen, can you address how that occurs?
Yeah. Well, the whole thing in a joint dysfunction, pain is usually the last thing that shows up. So you can have a career halfway through it, and then that's when things start messing you up. But it's from an injury that could have happened 2-3 years ago. And one of the things that happens when there is inflammation is it does attract calcium. It's called Wolff's Law, but the joint inflammation process that goes on begins to build up. Like you get the degenerative disc joint problems where you have bone spurs and things like that in the low back as a result of this inflammation that you may not have felt. And two things. One, on the horse side, one of the videos that I love is this horse that, comes running up to the loop as if to say, it's my turn, put this thing on me.
Right.
And that right there took away the placebo effect when I saw that. And then the other one is, firsthand, like again, in the powerlifting, I had a guy that was doing a competition on deadlifts, and he did 27, and he tied another guy. And so they had to do a tiebreaker. And that's when I pulled him aside and I said, this is really what this device is all about, how it shines. And so we put it on his back 10 minutes. And he stood up and he looked at me. He says, I feel as though I've just walked in off the street. He says, there's no fatigue, and he's like, what is this? And I said, well, microscopically, the mitochondria just reoxygenated your muscles. It, took out the ADP and turned it into ATP. So everything's back to normal. Any inflammation you had is gone. And he's, just shaking his head. And I took it to another powerlifting, competition, and there was a woman that needed to lift 10 more pounds to break the state record, and she had a mild injury in her back from the previous lift. So we put it on her back, just 5 minutes. She went out and she broke her record. She broke a state record. So she was, just totally thrilled. And again, what I like about this is we're not dispensing a painkiller. It actually just went in and changed the physics of what's going on. And long-term chronicity can be a factor, just like your friend Woody, when he was all stiff and sore, he may not even know he's stiff and sore because the body has a tendency to shut off that pain signal. And then once it comes back, that's when you realize that you've lost it. And that's, again, what Magna Wave does and what it's just phenomenal about using.
Right. I mean, it what's, again, as it develops, for example, when I talk about professional athletes, football clubs, we're doing some work with the Tennessee Titans, and they're using 3 devices now in their regimen. And the trainer called me one day and he said, in my 20 years as a professional trainer, this is the most powerful therapy I've ever come across. The players are standing in line to get treatments, and their biggest issue that they deal with is hamstring. And so if they can keep this rejuvenated and they can help it as soon as they have the indication of injury or stress, they can, in a lot of cases, reverse it and make things more comfortable for them. And then he says to me, I've got the most healthy team in the league. Now, that it is what it is, but that's how people look at this and how important it can be to help relieve and to prolong and improve them with their recovery and their day-to-day activities. So,
Pat,
okay, so go ahead. Go ahead.
I think one thing, since we're focusing on professional sports, one thing that professional athletes are really good at is you subconsciously learn how to compensate. when you have issues physically. And the problem with doing that is like with a golf swing, over a period of just a few weeks, if you start compensating for something and changing your golf swing to work around an area of your body that doesn't feel good, all of a sudden you've changed. It's like changing your signature. And it's not always as easy to get back to where you were as people might think. And so I think from that perspective, whether it's a quarterback or a pitcher throwing, or a golfer hitting, or a tennis player, using a racket for forehands and backhands and whatever, I think if you can keep yourself to the point where you never have to get into a compensating mode for issues with joints, muscles, or whatever, then that's money in the bank right there to a professional athlete.
Oh, absolutely. And compensation in the horse world, when a horse has a hip problem and then it translates to the shoulder, or it's got a foot problem and it translates to the shoulder, then to the hip, then to the sacrum, and next thing you know, we've got general overall soreness. Where do we begin? And that's something that this device can do, is kind of show you with sensitivity where to begin or where areas are. When I first started and I would treat racing jockeys at the racetrack, they'd come to me and they'd say, "Hey, Pat, my back is killing me. Will you help my back?" And so sure, I'd treat their low back, and they'd stand up and they'd say, "Gee, I feel so much better, and this is great. Thank you so much." And the next day they'd come back, "What did you do to me? My shoulders are killing me." Well, their shoulders were killing them the whole time. It was just their back was the main pain that they were feeling.
Right.
So then we'd work on their shoulders, and that would feel better. So we would kind of chase the pain or follow the pain around to relieve the overall situation. I'm sure you've experienced that, Dana, when you deal with horses, because you're dealing with such a muscle mass that it's incredible with the relation.
Well,
So,
Dana, you probably also with the
And
horses
so a lot of
and the
these-
trainers too, right? That the people that ride your horses have similar issues. When the horse is sore, then the trainer's sore too to compensate.
Absolutely. Or, if the rider rides multiple horses, make all of them sore. And what I found also with some of these, especially the golfers, because the golf world is fairly new to me, some of these hit 1,000 a day.
we're losing you, Dana. You're breaking up real bad. I don't know.
I mean, I can't imagine.
Right. Dana, thank you. You're breaking up real bad. We're missing a lot of what, that's okay. A lot of what we're getting, and we certainly want to, we'll do this again to where we make sure that we have that. But, to go back to that, Jerry, you're absolutely right. In the horse world, you'll have it's funny, if the horse is sore on the left-hand side of the back, so is the rider. In a lot of cases, and they'll experience the same type of things because they're one. When they compete, they're one, and the legs are so important to them as they work and guide the horse and manipulate, and certainly how they're sitting and the whole thing. So the two of them together are very critical to each other. So, and I think that's what Dana was referring to, is how important it is and how it all does play together. So from your perspective, Dr. Dreesen, when you deal with this and you deal with athletes, what do you tell them? What's this outside range of motion and all of that to help them understand how important it is to revitalize and to keep them going?
Well, the athletes are pretty easy because it's a way to improve their performance and longevity. And those are the two keywords that every athlete wants to hear. And the higher the professional level, the more you have with the athlete that is geared into a certain muscle memory all the time. And so they have a higher caliber of, just like you're saying, Woody, as far as they have their swing, and that swing is money for them. And they know when they're hurting, not necessarily feeling pain, but they're changing their swing because they're not getting the distance or the accuracy. And so now they're changing up, and they're taking possibly years of coordinated muscle memory and having to alter that. And that in of itself over time can cause a problem because it's not part of what their body does naturally, or what they've created over a lifetime for their career to get to where they need to be. And so When I'm working with athletes, classically they'll come in and they've got an issue, and we'll do the history, the exam, the orthoneuro test. We'll narrow it down to a certain area, and it's either a tendon or a muscle or a joint, and it's inflamed. And so we'll go ahead and take the Magna Wave and just focus it right over the area of their initial pain. And we'll use pain in this one because I'll also do measurements, and that's how we can find dysfunction without pain, is they're just not getting the range of motion right. And then afterwards, we either do range of motion again to show objectively that it's changed, but subjectively, if we're on a painful area and we're just doing a couple minutes and then they start moving their arm or their shoulder or their back, they always have that same look. It's like, okay, I don't know what this just did, but my pain's gone. Or it's, I'll have them answer on a 0 to 10, 10 being the worst, 0 being none. Where are you? I'm about a 7. We'll set it up. Yeah, I'm about a 2 now. Then they'll say, what is this? And they go, well, I think my physical therapist has one. It's like, no, I'm pretty sure we're the only one in Washington State that has one at the moment. And then walk them through and give them the information, and then they'll come in and they'll treat 2 or 3 times a week, and then their symptoms start to go away, and then we can start looking at again what caused that. Was it just the repetition, or was it are their arches dropping? Do they have a dropped arch? Do we need to give them orthotics? Things, what happened over time that started to create this, and it allows me to focus more on what is the true cause of that problem. And then once we get that addressed, then they can start walking away and know that they're not going to recreate the problem. So it's been a great modality for me to use with all the athletes that I've been treating.
That's excellent. I think we need to point out that in many cases, people have a situation, and it's probably like the hands, Woody, that you were talking about, and Dana. When you first do it, yeah, it's better today, and tomorrow it might be even a little better, or next week it's even better. And in many of these cases, when you've got years of stress that you're dealing with, where you can get an improvement in one treatment, it takes multiple treatments in some occasions, in some situations, to get it to where it's reversed or where it's usable to the point where they want it to be. Have you experienced that, Dr. Dreesen and Woody?
So I have, of all the people that I've treated, I have one person that is just stubborn, that their body, for whatever reason, is slowly responding. But we look at, they've been treating a year. We look at what they did a year ago, with all the notes, where they couldn't sit down and cross their leg to put their shoe on, and now they can, but they're still overall just don't feel like they used to. But it depends on how many areas were affected, how bad it is, and now you go into the physiology of the patient. You might even be going into what their blood type is. Who knows? There's a lot of different things that are going on. What is their nutrition? Are they feeding themselves? Are they drinking properly? And then the big one too is, what medication are you on, and what are the side effects of that medication?
Correct.
And oftentimes I'll be working on somebody with low back pain, and it's the medication side effects that's causing.
Oh, lost Jerry. Are we there? Yeah, I think we're here. Jerry, we lost you there for a second. Are you back with us? Yeah, but that's very, very good when we talk about that. Everybody doesn't get it immediately, but it can come. Ladies and gentlemen, those of you watching, if you have any questions, if you'd like to address one of us, we'd be more than happy to take your questions. I think the information has been excellent. It's an eye-opener as to how it can work, and as Woody pointed out with BJ and how he saw, and in himself, how he saw a difference immediately. And a lot of times in these situations, it's how quick you get after it. When you first have a problem, to get after it as quickly as you can. That's what the Titans have found. When somebody has an issue, let's start on it today. Let's don't wait a week. Don't let the inflammation set in and all of a sudden now it's a problem. We want to get on it as we can. Any other comments from the group before we're about out of time? It's been a great time together. Anything that you would like to share, Dana?
Nope, I'm good.
You're good. Thank you, Dana. Ives, appreciate you being with us. Woody, how about you? Anything that you want to add before we head away?
I think the biggest thing for me is just I want to learn a little at the scientific level what's going on, because I think it can be extremely valuable to talk to people that are treated and give them a, not necessarily a, but a sort of a scale dumbed down of what's really taking place using this technology and how it differentiates from anything else that's out there, i.e. TENS units or anything. So I think that can in helping people understand why they're feeling better and give them more confidence that using this is really the right way to go.
And that's a great point. And I'll cover that very basically quickly here, and then we'll ask Dr. Dreesen for his final comments. But basically what this is doing is that the signal that's produced with these high voltage, low frequency PEMF machines, it's a pulsed electromagnetic field that penetrates into the body, basically delivers energy to the body that approaches the cell membrane and allows the cell membrane to become more permeable, allowing more oxygen into the cell. If the cells can become better oxygenated on their own, then they will help take away inflammation. They will be in a better position to help the body heal itself. In many cases, we're not really doing the healing. We're just enabling the body to be in a position to take on oxygen. Well-oxygenated cells can work miracles from my perspective. And if we can allow that to happen, and that's basically what it is, we just energize the cells, let them take on more oxygen, let them better do the job, and let the healing follow from there. Dr. Dreesen? Oh, we don't have Dr. Dreesen. We lost his microphone. We don't know what happened there. And, I got to do a drawing. We have, and we'll come back to Dr. Dreesen here. I'm going to have a drawing. It's the Christmas weekend. For those of you who are watching this at another time, it's Christmas time at this point. And we've had a drawing. We've had a contest for a basket of supplements, a $1,300 basket of supplements that we're giving away. I have the entries here, and we're going to make a contribution to a horse rescue and to Bear Care Food Bank from everyone that did this. And Magna Wave is going to match the amount of the contributions for this. So here we go. I'm going to mix them up, and then I'm going to pull one out of the bucket. Here it is. And the winner of the gift basket is Heather, Louisiana, is the winner of the contest, and we'll be getting in touch with her and giving her her basket of supplements from Magna Wave. So, Dr. Dreesen, do we have sound back? No, we don't. Well, doggone it, he was going to add a great point, I'm certain. Doctor, I'm sorry we've lost your sound. Woody, I want to thank you for being with us. Dana, Ives, thank you for being with us today, and we certainly look forward to doing this in the future. We have these webinars every Thursday, Magna Wave Wellness webinars. We like to deal with products that Magna Wave can enhance if we talk about other products or complementary usage, and we want to talk about specialized uses where Magna Wave can be beneficial to the health and wellness of the people that are involved. So, folks, Dana, Woody, Dr. Dreesen, Jerry, thank you so much for joining us, and we look forward to having you back and doing this again in the future. Happy holidays, and thank you a lot. Bye-bye.
Enjoyed it. Merry Christmas, guys.
Thank you.
Merry Christmas.